So the Clostridium topics are put into 4 different groupings: gas gangrene, enterotoxemic, intoxication, and other. First gangrene topic is malignant edema. The species are Clostridium septicum, novae, histolyticum, and sordelli. The hosts for these bacteria are all mammals and all birds. They enter the body through wounds. In the wounds, there is decreased oxygen tension, which causes an aerobic environment. This causes the bacteria to replicate, which then leads to hemorrhages and edema. In the wounds, we can see necrosis, swelling, and crepitation, so gas bubbles. Clostridium septicum has gas bubbles, novae doesn't have gas bubbles, and histolyticum has liquefying tissues. The next gas gangrene disease is blackleg. It's caused by Clostridium chauvet. In sheep, the bacteria enters the body through wounds. However, in cattle, it's an endogen infection. In the wounds, there is decreased oxygen tension, which leads to an anaerobic environment. This causes the bacteria to replicate, which then causes hemorrhages and edema. The alpha toxin, which is spread through the blood, can go to the brain, which can cause the respiratory system to fail. In the clinical signs, if they don't die, we will see muscle necrosis, edema, and crepitation from the gas bubbles. This is why the disease is called blackleg. For most of these diseases, we can diagnose using PCR or ELISA. However, in the case of blackleg, we use immunofluorescence, as it allows us to differentiate Clostridium chauvet with Clostridium septicum. The next disease is Bradsot. It is caused by Clostridium septicum. The word Bradsot is Old Norse for quick sickness. This is how you remember that the disease is from Scandinavia. It occurs when sheep eat frozen food. This is because the frozen food causes erosions in the alimentary canal. Then the beta toxin of Clostridium septicum will cause erosions of the mucosa, and this erosion of the mucosa will allow the alpha toxin to get into the bloodstream. When the alpha toxin gets into the bloodstream, it inhibits the respiratory center in the brain, which causes respiratory failure, and the animal dies from suffocation. In the post-mortem, we can see hemorrhages, necrosis, and thickening of the abomasum, as well as gas bubbles from the crepitation. Kovesh disease is very similar. It is also caused by Clostridium septicum. However, the damage in the stomach is not caused by frozen food. It is from the esophageal ulcers that the pigs get when they're very stressed. When these ulcers are present, the beta toxin can cause necrosis of the mucosal membrane, and then the alpha toxin can enter the bloodstream. The alpha toxin will go to the respiratory center in the brain and cause respiratory failure. In the post-mortem, we can see a thickened stomach as well as gas bubbles and crepitation. The next disease is infectious necrotic hepatitis. It is also called black disease because the liver becomes black. It is caused by Clostridium novae. This bacteria has no crepitation or gas bubbles, as it causes very little carbohydrate fermentation. This disease happens when sheep and goats get liver fluke. The liver flukes will cause minor bleedings within the liver, and this allows the beta toxin to come to these areas and increase the permeability. And when this happens, then the alpha toxin enters the bloodstream and it goes to the respiratory center in the brain, which causes respiratory failure. To treat this disease, you give antiparasitics to stop the liver fluke. The next disease is bacillary hemoglobinuria. It is also called red water disease. It's found in South America and Australia, and it's caused by Clostridium hemolyticum. It produces beta toxin and lecithinase, also known as phospholipase C. This will cause IV hemolysis and will then spread to the liver and to the kidney. As a result, the animal will get jaundice and become anemic, and the bladder will fill with blood. For the first enterotoxemic disease, we have lamb dysentery. Lamb dysentery is caused by Clostridium perfringens B. It occurs when young lambs are suckling on a feces-contaminated teat. This allows the beta toxin to enter into the lamb's body. Beta toxin is normally inactivated by trypsin. However, young lambs that are still suckling do not have any trypsin. The unchecked beta toxin will cause vessel damage, which will cause a lot of pain for the lamb. The lambs can have hemorrhagic foamy diarrhea. The foam is from the carb fermentation, and there will also be necrosis of the small intestines. To prevent this, vaccines and penicillins are given to the mother, as they will then pass it on in their milk. The next disease is called struk. It is caused by Clostridium perfringens C. The disease is called struk because it appears that a very healthy animal just suddenly dies, as if it was struck down. It occurs when very overweight animals are fed a lot of carbs and very little fiber. This means there's a huge amount of bacterial overgrowth, and the bacteria can't be moved out of the body through peristalsis. Even though adult sheep have trypsin, so much beta toxin is produced that it's more than the trypsin in the body can handle. As a result, Damage happens to the blood vessels and alpha toxin gets in. This alpha toxin will go to the respiratory center in the brain and the sheep will die from suffocation. The next disease is necrotic enteritis of piglets. Similar to lambda century, however, it is caused by Clostridium perfringens C and not Clostridium perfringens B. It occurs when young piglets suckle on a fecal contaminated teat, and since the young piglets do not have trypsin, beta toxin will then damage the vessels, and this allows alpha toxin to get into the vessels, and then it can go to the respiratory center in the brain, and the piglets will die from suffocation. In the pathology, we can see necrosis and ulceration of the small intestine. To prevent this, we give vaccines and penicillin to the mother, the sow, and then she can pass it on in her milk. The next disease is enterotoxemia of sheep and goats. It is caused by Clostridium perfringens D, and it causes pulpy kidney disease. In the case of an obese sheep that has very little peristalsis, Clostridium perfringens D will release a toxin called epsilon toxin. Epsilon toxin is activated by trypsin, and it can cause edema in the brain, the kidney, and the liver. This edema in the brain will cause CNS signs, such as ophthalmos and tremors. It will also result in hemorrhagic enteritis, as well as autolysis of the kidney. And in some cases, it can allow the alpha toxin to get into the blood. The next disease is necrotic enteritis of chicken. It is also caused by Clostridium perfringens C, but it can also be caused by Clostridium perfringens A. It occurs in 2 to 5 week old broilers and 7 to 12 week old turkeys. The predisposing factors are coccidiosis, mycotoxins, and wheat, as well as fish meal. It's the same as the pigs. The beta toxin will cause gut necrosis and blood vessel damage, and the alpha toxin is cytotoxic. In the clinical signs, we can see necrosis of the liver and necrosis and inflammation of the intestines, as well as foamy brownish diarrhea. For ulcerative enteritis of chicken, it is caused by Clostridium caninum. There is no carbohydrate fermentation, so that means there's no gas bubbles. It is also called quail disease. It occurs in broilers that are 4 to 12 weeks old and turkeys that are 3 to 8 weeks old. The predisposing factors are stress and coccidiosis. These will cause ulceration of the intestinal tract, as well as grey, non-foamy diarrhea. It's non-foamy because Clostridium caninum doesn't have gas fermentation. The next grouping is intoxication. Tetanus is caused by Clostridium tetani. The toxin is tetanospasm. This is the only factor in the disease. The bacteria does not play a role in the disease, only the toxin. Horses are most susceptible, then small ruminants, then cattle, and then swine and carnivores are least susceptible. It occurs when there are wounds or a nail puncture, and then when anaerobic conditions occur due to other bacteria using up the oxygen, the Clostridium tetani bacteria will germinate tetanospasm, and then tetanospasm will get into the bloodstream and then head retrogradely up the neurons. It then cleaves synaptobrevin and inhibits the release of GABA, and this causes the muscles to not relax and they become very rigid. The clinical signs are a prolapse of the third eyelid, erect ears, and the sawhorse position. You can prevent this through cleaning wounds and using vaccination. The next disease is botulism. It is caused by Clostridium botulinum toxin. There are 7 different toxins that go from A to G. Just like tetanus, the toxin is the only factor playing a role in the disease. It affects all animals, however, it is very common in foxes and minks on fur farms. The clinical signs are flaccid paralysis. The toxin gets into the body through the consumption of rotten protein. This causes the hydrolysis of synaptobrevin. This is not to be confused with the cleaving of synaptobrevin, which happens in tetanus. As a result, the clinical sign is flaccid paralysis, and this is irreversible. To prevent this, you can change the feed and also you can vaccinate them. The last grouping is other. Tizer's disease is caused by Clostridium piliform. The hosts are horses, and it's also maintained by rodents, and cats and dogs can also carry the infection. Bacteria is taken up into the body orally, and when the animal is stressed, the bacteria will replicate in the gut. It will then get absorbed into the bloodstream, and it will then go to the liver and the heart. In the liver, focal necrosis will occur, and this will cause the horse to get jaundice. Horses can also get colic and diarrhea, as well as hemorrhagic fluid in the pericardium. For treatment, you need an intracellular antibiotic such as erythromycin or tetracyclines. There is no vaccination. For gangrenous dermatitis, it is caused by Clostridium septicum, Clostridium perfringens A, and Staphylococcus aureus. It mostly affects turkeys and broilers that are under 5 months old. When they have wounds, Clostridium and Staphylococcus will colonize the area, and then Staphylococcus will use up all the oxygen, and this will allow conditions for the Clostridium to enter the wound and replicate. The Clostridium will then produce gas and toxins. It will result in hemorrhages and ulcers on the skin of the wing and the breast and the thigh. It can also cause liver necrosis.